News continues now as the rest of the world continues to evaluate commitments to achieving universal healthcare coverage. Kenya's attempts to provide UHC remains shrouded in mystery. President Uhuru Kenyatta sharing little information on the topic during his Jamhuri Day speech, despite the day also being marked as World Universal Healthcare Day. Rakam Wigai has more.
Striking healthcare workers, reports of Kenyans who cannot afford to pay for medical care continue to be an ordinary occurrence. This 2 years since the launch of the pilot Universal Health Coverage Program by President Uhuru Kenyatta in 4 counties, Kisumu, Machakos, Nyeri and Isiolo, that was termed as a failure by the Council of Governors.
That money is paid.
According to Dr. James Nyikal, who once served as the Director of Medical Services in the country, the fate of UHC lies in how the various challenges within the health sector will be addressed, and specifically through the use of legislation to resolve some of the issues.
We need a broad legislation based on policy, national policy on universal health coverage as financed through insurance. A policy that we are told is in progress, but we haven't seen it. When we have that, then you will have an encompassing law that will look at areas like financing, which I've said, making sure everybody pays, and who pays for the indigents.
2020 would have seen Kenyans enjoy the UHC program, but there were numerous complaints from the 4 county governments that implemented the pilot program.
We were meant to receive about 877 million shillings. Unfortunately, we ended up receiving only 622 million. Which really meant that the county had to bear a lot of burden actually finding resources or going into debt to provide health care during the pilot scheme.
An intergovernmental UHC meeting in Mombasa was organized, the main resolve being the issue of the National Health Insurance Fund, which despite being mandated to serve the public, is largely ineffective in addressing comprehensive care.
With the rollout of the UHC, this is bound to change as we reform NHIF to deliver UHC. It's a shame that NHIF has actually more certified public facilities, yet spends less on them in resource terms because of the quality.
You will also need a legislation that covers the cost of care. That we don't have in the country now. There should be some arrangement that can regulate the cost of care.
Other resolutions from the meeting being recruitment of UHC health workers, transfer of payroll to county public service boards from the Ministry of Health, and payment of community health volunteers. Dr. Nyikal is of the view that legislation to guide key institutions in the health sector, such as KEMSA, will help solve the issue of the monopolization that was faulted by county governments for delaying medical supplies procurement.
National government has the function of standards and policy, but there must be an arrangement where they can actually, working together with the county government, enforce those standards so that all people are doing the same thing.
As per the UHC data portal, Kenya still has a long way to go despite its commitment. Refugees, migrant laborers, drug users, older persons, sex workers and persons living with disability are listed in the portal as categories of people who are yet to enjoy quality and affordable healthcare.
Although we have some challenges in the health sector, we must remember that our endeavors are a work in process. Building a robust healthcare infrastructure at the county level has to go hand in hand with protecting our health workers as well. And indeed, my government is working on this.
With the pilot project having ended unceremoniously, the fate of UHC hangs in the balance. Rakam Wigai, Citizen TV.